Hello, my name is Christine Song, and I'm a 15-year-old girl that lives in Rochester, Minnesota. I am starting this YouTube channel in hopes of getting all the teenagers around the world with a parent that has breast cancer to understand that they're not the only ones in this tough journey and that we're all here for them. And finally, to share what we learn about breast cancer along the way so that maybe in the future we will be able to develop a cure for breast cancer. So before I begin and state the actual statistics and facts about breast cancer, I would also like to share my personal story with you guys as well. It was the summer between 5th and 6th grade, so about 4-ish years ago, and it was the last day of school. I was very ready for my mom to come pick me up, and we would just go home and sleep and just enjoy summer to the best of our abilities. So, as soon as I saw my mom arrive, I quickly made my way towards her, but I regretted it. Because as soon as I reached her, she told me the very sad and shocking news of her having breast cancer. At the time, I was young and immature, so I didn't really understand the full complexity and severity of breast cancer. However, I knew it was a bad thing because a couple years back, my grandma had gotten a different type of cancer and it wasn't the best experience. So when my mom said that she got breast cancer, I was obviously very sad, but I wasn't 100% sure as to how to react. But all I know is that that summer, things didn't go as I planned. I remember her getting a surgery on her breasts for a double mastectomy, and after surgery she had these tubes sticking out from the sides of her body because the fluids would have to go into those little bottles that they provided, and we would have to change it every so often. She cut off most of her hair for chemotherapy. And as each chemotherapy treatment went on, she would start to lose more and more hair until she was finally bald. And a lot of the side effects, I just had to see her going through them. And it was a very, very rough time. Because honestly, who likes to see their mom, their role model, crumbling down because of this one disease and illness? But during the time, it was hard. It was very, very hard because I would look at other families that were just walking in the street, outside of the window, through the car, while walking. And I was just wonder, why cancer had to attack my family and why we couldn't be like this strong, happy mother-daughter duo that we were. And I remember thinking that I didn't want her to see me cry. I didn't want her to see me be weak because she was already going through such a tough time. So I remember just going into the restroom, the closet, just pretty much anywhere, closed and confined, to cry my heart out. And then wash myself up so that she wouldn't notice that I had been crying. And just being really, really sad during that summer. And after all of her chemotherapy treatments, she was deemed cured from breast cancer. However, recently she got a recurrence, which means the cancer came back again. And the only thing that I'm doing differently now is that I'm actually studying about breast cancer more, and I know about its different complexities. And also the fact that now I'm trying to look at things in a more positive outlook. So I know that during this time, a lot of you guys will probably be struggling, terrified, sad, angry, and all that. And I felt that too. But as I said before, I live in Rochester, Minnesota, and this place is the home to one of the best hospitals in the world, also known as Mayo Clinic. And at one of the appointments that I had to go to with my mom for her checkups and follow-ups, Mayo Clinic and her oncologist gave me 2 books that kind of shifted my attention. The first book that they gave me was the Mayo Clinic breast cancer book. So this book technically talked about the breast cancer facts and like the stages, the different types, the treatments, and etc. But the second book that they gave me left the most like strong impact on me, and it was this book called Cancer in Our Family. And this was targeted towards the children that had a parent with any type of cancer and how to kind of cope with their feelings and how to just help their parents during this hard time. And I guess you could say that this second book was one of my large inspirations for starting this YouTube channel as well. So, as I just say now, I know this is a very tough time, but I hope that by watching my video, you guys will be able to feel a little bit more at ease with more knowledge and with more confidence. So now I will start my first video. So now to start my video, I will be going over the basic statistics of breast cancer, the different subtypes, how they are characterized, and the different treatments available. And for this video, I will just be stating the very basics. So according to the 2018 Magellan Health Insights, breast cancer is the leading cause of female cancer death in the United States. And in 2016 alone, around 250,000 people were sadly diagnosed with a more aggressive and invasive type of breast cancer. However, on the contrary to these sad types of statistics, a good statistic that came with this was that in the overall 5-year survival rate of breast cancer patients, these patients have a 90% chance of living. And with me stating these statistics, I know that for some it may bring sadness and anger and all these complicated emotions, while to others it may bring a more happiness and a more chance and a hopeful feeling. And I would like to tell you guys to choose the latter side, to choose the more happier, brighter, more hopeful side, because a lot of things change depending on how you look at a certain situation, which I had to learn personally firsthand. So now stating the actual facts of breast cancer. Breast cancer can be characterized according to this chart into 4 main different categories. First being luminal A, then luminal B, then HER2 positive, then triple negative breast cancer. Luminal A and luminal B can technically be characterized into an even bigger group called the hormonal breast cancer groups. So now, how are they characterized? Each subtype of breast cancer can be characterized based on their expression levels in the ER, PR, or HER2 gene. ER standing for estrogen and PR standing for progesterone. Luminal A breast cancer patients have an expression in either estrogen or progesterone. Luminal B, there are 2 types of luminal B breast cancer patients. The first one being that they have no HER2 expression, but an expression in either the estrogen or progesterone. And the second type of luminal B breast cancer patients being that they have an expression in both the HER2 gene and the estrogen or progesterone. The HER2 positive breast cancer patients have only an expression in the HER2 gene and not the hormones. And then the triple negative breast cancer patients have no expression in either the hormonal receptors or the HER2 gene. And the difference between the luminal A breast cancer patients and the luminal B's first type of breast cancer patients are that the Ki-67 values differ. And this will all be explained later in my videos in a greater amount of detail. And so for the treatments that are available for these different types of breast cancer patients, there are several. So one, there is a treatment available for all types of breast cancer patients, while there are also other types of treatments that are only available towards a specific group. So first, the overall treatments include chemotherapy and radiotherapy, or also known as the radiation therapy. Then the second type, which is for specific groups, there are such things such as the hormonal therapies, which is used to target for the hormonal breast cancer patients. And then there's also a therapy drug called Herceptin, which is used for breast cancer patients with a HER2 expression. So that was it for this video's basic breast cancer facts. And I would like to mention that since I'm also only a teenager, what I may be saying may not hold true for all of you guys, and especially in like the order in which it goes, because that all depends on the patient, the hospital, and the oncologist/doctor. But through this video, I just hope that you'll be able to gain more knowledge, obviously, about breast cancer, but most importantly, feel more at ease about the situation that you're in, and just feel a little bit more hopeful than you were before. I really want to thank you guys for watching today's video, and my next video will be on about a more in-depth talking about breast cancer in general. Thank you guys.